This patient was referred to me for endodontic retreatment of tooth number 30. Take a look at this root canal. So crown here, previous root canal, as you can see, a prefab metal post in the mesiolingual canal, and look at that huge periapical lucency there. All right. So we went over options with the patient. Patient wanted to try to save the tooth, and that's what we did today. Today we went through the porcelain crown here, removed an enormous, a gigantic, a huge prefab metal post, and these were plastic thermofill obturators, and they were wedged in. So look at the size. Look at the size of that darn post. And these plastic thermofill obturators were wedged in, very difficult to remove. I was able to bypass them, and then as I bypassed them, then I used my flare file and brushed them out of the teeth, out of the canals. Brushed them out of the canals. Okay, but man, don't like these. Don't like the material. Material is fine. Don't like when the dentists use them and they don't know how to use them. They don't know how to use them properly. But take a look now. So look at this beauty now. A missed middle mesial canal. The dentist had missed. And look at the difference. Look at all of that anastomosis between the canals. Look at all of that. Look at all of that anatomy there. So let me put them next to each other so you can appreciate the difference between what we did today and what the dentist had done originally. I'll put them next to each other so you can appreciate the quality, the workmanship. This is pre-op and this is post-op. Pre-op and post-op. You see the difference? This is how it should look like every time, not that. That just means I just want to get white lines in the canals and submit the x-ray to the insurance company and get paid. That's what that means. This means I love what I do, I care about my patients, and I do my best. And that's the outcome. That's the difference. Caring, knowledge, of course, knowledge, understanding of endodontic therapy, fundamentals, and being passionate about how you do things versus that. Pre-op, we got that huge periapical lucency there, and what patient left with. All right, very good. Everything went, we did it in one appointment, of course. Everything went beautifully, as you can see. We went ahead and temporized the tooth and referred the patient back to our dentist for the permanent restoration. I can show you more angulations also. That's one angulation. That's another angulation. That's another angulation. So much anatomy that was missed originally. Another angulation. You need to trough for those middle mesials. You see how many I find? They're there. You just need to look for them. You can see how huge that periapical lucency is right there. So regaining patency in all canals, locating all the canals, then proper three-dimensional instrumentation, irrigation, obturation. Of course, don't forget sonic and ultrasonic activation, 6% sodium hypochlorite copiously throughout the procedure.